For me, as a survivor, and it's been 19 years, so the change over time has been interesting. But I remember actually the treatment was the easy part. It was kind of focusing on, okay, I'm going to get treated, and honestly, worrying about life and death, I finally had come to terms with, okay, this is my best shot of me surviving, and that, I was actively doing something. So that was for me very powerful. It helped me focus, and the distractions about worrying about other things was pretty minimal. It was when I finished treatment that I found I had the biggest struggles. It was about, for me, worrying, could it come back, and not quite understanding, what the risk was of it coming back. That was hard, and I think the other thing was worrying and knowing that the treatment came with long-term risks with it, that concerned me as well. So I think that was probably the hardest part, because it was frightening to me to try and think about, is it going to come back, and that living between visits, when they draw your blood, do your scans. It was very hard, and getting up to where I'd come in for a visit to find out, have I relapsed or not, that was very stressful. And then you got this relief, but it was a fleeting relief of, oh, there's nothing there. What helped me was speaking to the nurses, the doctors. I spoke with my social worker, and I had a psychiatrist that I worked with after treatment, because they helped me to develop the coping skills that are needed to better kind of get back to a normal life, because you're expected to go back to normal life, and you've got all these fears and unanswered questions, so you're almost leading a dual identity of, okay, I have to look on the outside like I'm completely normal and functioning wonderfully, while I've got all these fears inside. And you also don't want to burden your family. So for me, the most helpful thing was to work with professionals to develop skills to be able to deal with a very real fear that it could come back, because anyone that says it's not going to come back is lying to you, because it's still a risk, and it's just trying to figure out how you can live with that risk and cope with it. I realized that worrying about the things that I could not control only caused me, we'll call it negative emotions, if you will. But looking at what could I do, what were the things I could control, and that was finally being able to kind of let go of the worries of things I couldn't deal with, and trust that my doctors and nurses and everyone was doing that. What I focused on early on was, I want to be healthy, and I want to get healthy. And then as time went on, my fear of relapsing became less, but then I started to worry more and more about, well, what could chemotherapy and radiation, what effects long-term do I have to worry about? And there are effects that we're all at risk for, because no matter what treatment you get, there are risks. And this was actually being able to focus on what is it I could do to, instead of worrying about it could happen because I did get treated. I mean, that's in the past, I can't change that. But one of the most helpful things for me was to speak with my doctors, my nurses, and the specialists that I ended up seeing, like a cardiologist, and was, okay, well, what are my risks? I want to understand my risks better. And then once I understood what they were, is there any evidence out there that I can lower my risk? Is there anything I can do? I had higher risks for a bunch of things, whether it's second cancers, whether it was, cardiac disease, things like that, that after better understanding what my risk was and what the other risk factors might be, I focused on the modifiable ones, meaning eating a healthy cardiac diet and lowering my cholesterol. Things that I could control would have an effect on lowering my risk. So instead of, and again, I did plenty of poor me that it was stressful that, yes, I had higher risks than my brother who never had treatment, or my friends who, and it was a pain because I had to come to the doctor much more frequently than most 28-year-olds at the time. And, but then understanding that, look, I can't change that, but there are so many things I can do to lower my risks of long-term health problems. And focusing on that has helped me to cope emotionally as well, that look, I'm doing everything I can do. I'm getting the screening tests that I'm supposed to be getting. I'm getting I'm getting my blood work done, and I'm following up. If just recently, I was honest with myself, and I lost 20 pounds because, again, I know that lowers my long-term risks for things. And you're not a crazy person because you're stressed and worried and fearful. Crazy people make things up in their head. Survivors are not crazy. They have very real things and risks to worry about. But when they start to make your quality of life poor, and that's what I would say it does to a lot of people, including myself, especially early on, is that fear and that worry overtook any sense of enjoyment or things like that because I was so focused on them. If that's the case, you're not crazy. There are very real risks, but it doesn't, just because you know why you're worried doesn't make it acceptable to live your life in fear. That's when it's time to speak to a therapist or speak to a psychiatrist, because your quality of life is as important. That's something I've talked about a lot with people is QOL, quality of life, and QOL, quantity of life. Quantity of life is an awesome thing, and I'm so grateful for being, here because the treatment saved my life. But if your quantity of life during that long period of time, it's been 19 years and hopefully a lot longer, if your quality of life is poor, that's just as bad, because that's kind of torture. That's not. You need to have a good quality of life as well as quantity of life. I couldn't emphasize enough that as much as we talk about a lot of things, we focus on are the physical effects of all of this, and that's very real, and you need to worry about those things. The emotional impact it has on you is probably harder to deal with than dealing with the physical things, because for me, I was wired when I was growing up that you should be tough enough to deal with things, you're a guy, or just growing up and, just being taught that, trying to deal with your own problems and things like that, and realizing that, look, this is something that's maybe beyond your scope of being able to cope with. There's something that could actually end your life. When you're told that, it's a game changer. And being, I guess, humble enough to understand that as much as you need help, and you've gone to experts to get rid of your cancer, the emotional impact of it, you should also be focusing on working with professionals to make that an easier transition.